on the home screen, it shows glucose, active insulin, insulin delivery, and active carbohydrates. But it doesn't just tell you the numbers. It shows you graphs of how they've changed over time and kind of what things will look like. It shows you, I think, 6 hours of prediction of, the insulin absorption and when the insulin will kind of wear off, where your glucose is headed. So I really like that predictive feature, and it's something that other systems don't have.
Welcome to Think Like a Pancreas, the podcast, where our goal is to keep you informed, inspired, and a little entertained on all things diabetes. The information contained in this program is based on the experience and opinions of the Integrated Diabetes Services clinical team. Please discuss any changes to your treatment plan with your personal healthcare provider before implementing.
Welcome to Think Like a Pancreas, the podcast. I'm your host, Gary Scheiner. Today, we're going to do the twist, just like Chubby Checker did some 70 years ago. My God, that was a long time ago. I'm delighted to be joined by a friend and peer and colleague and mentor in some ways, Justin Eastzer, who's founder and content creator with DiabeTech. And it took me a long time just to learn how to pronounce DiabeTech correctly.
Yeah, but you're doing so well. You've got it down.
Thank you. I appreciate that. I practiced over and over again. And I mean, I should know it by now because Justin's had me on the podcast many, many times. We have a series that we're running together. Justin, just in case there's anyone out there who doesn't know who you are, can you tell us a little bit about yourself?
Yeah, so my story starts 4 years ago. I was diagnosed thanks to TikTok. I was misdiagnosed as type 2, as so many are, and then started posting videos there, and people were like, nope, you have type 1. And so I just kept making videos on social media. I was already a tech YouTuber. I worked in Hollywood, so I loved to create content. And I just realized how much technology there was in diabetes, and I love tech. So since then, I've tried as many systems and pumps and CGMs as possible. I'm still on that journey. And whenever news comes out, I share the news. I have social media pages that are DIABE_tech, DiabeTech, a podcast, which you come on once a month and we do our Optimizing Diabetes Tech show, which is awesome. I also talk to like execs and leaders in the space about what's going on, but also people that use the tech. And then we've got our website where we post like the latest news. So that's where usually like the news, as soon as it drops, that's the place we get it to first. So our website's diabetech.info. And I also just put up like opinion pieces too. And I have a YouTube channel where I, put up reviews and first looks and app walkthroughs of all this stuff.
You sound like a slightly younger, more tech savvy, and slightly better looking version of me. Would you say that's true?
Pretty much, with hair, more hair in the center.
Well, any hair would be more hair. Yeah. So what's happening at DiabeTech? Because it's a challenging field. Podcasting is not the easiest thing to be doing these days and succeed at. So what are you doing to make it successful?
It would not be as successful if it weren't for the team behind me. I have editors, I have a manager, I have an employee working for me every week, helping upkeep social and the website. I have a social person who's, focused on posting social videos. So I'm starting to build out a team that takes care of all the aspects of the business because it's a lot of work and there are so many parts to my business and it's almost too much for just me. So I'm still working to strengthen all the areas of the business. I want to bring on another person full-time to take full ownership over YouTube, podcast, and brand partnerships. So that's kind of like my next step with DiabeTech. We just got back from CES, the biggest consumer electronics show, where Omnipod had a booth there. So I went and saw that. Abbott always has a huge booth. So I went and saw that as well. I worked with them and created content. I was also on a panel for it was all about livable tech. It was hosted by Insulin, and I was on the panel with like the CEO of the Calm app, all about how tech companies can make tech that not only keeps us alive, but also allows us to live in the moment. So that was a really interesting conversation. But yeah, I'm kind of just working hard in my new studio in Los Angeles, building out the team and trying to stay sane. And it's
Yeah.
working. I think I am.
Yeah, I like that concept of tech that doesn't just perform a function, but also enhances quality of life. Because in the diabetes space, we've seen our share of technologies come and go that forgot about the quality of life part. So, what are some of the devices that you've personally used over the years? Let's start with the pumps. Which pumps have you tried?
I started with the Omnipod Eros, which was just like the manual Omnipod. Then I went to Omnipod Dash with DIY loop automated algorithm, and I used those pods with the G7, the Dexcom G6 and G7. Then I used Omnipod 5 as well with both G6 and G. I've used the Tandem Mobi with Dexcom G7. I've used the Libre 3 and the 3 Plus as well. And more recently, I've been using the Libre 3 Plus with the Twiist pump. And I also, back in the day, was using IAPS, which is now kind of moved toward and has become Trio. I use that with the Omnipod, and that is just a more advanced algorithm. And I used that for almost a year, but I stopped and I went back to DIY Loop. And then now I'm back on and now I'm on Twiist. But I do think I'll go back to that eventually. But there's still a bunch of pumps and CGMs that I want to use. So I'll
Okay.
probably work on those first.
Okay. Yeah. So today, we're going to be focusing in on the Twiist, which both of us have had a chance to use over the last several months. And when I describe the Twiist pump, I always imagine a slightly large Oreo cookie. That
Yeah.
the thing is, when you get like a double stuffed Oreo, you twist it apart and you get that cream center. And it's sort of the way the Twiist pump is built. The wafers are made up of the cartridge that holds the insulin, and the other half is what holds the electronics and the motor and things like that. And then we twist those together to make the complete pump, or in this case, we're making a slightly larger Oreo cookie. So, what did you find? What have you found unique about the Twiist system?
Yeah, I think part of what I found unique was a lot of what I found unique when I originally started DIY Loop. I mean, first, it's the interface. The interface gives you a lot of information right on the home screen. It may feel overwhelming to people at first to see it, but I think once you understand it, it becomes really helpful and supportive. On the home screen, it shows glucose, active insulin, insulin delivery, and active carbohydrates, but it doesn't just tell you the numbers. It shows you graphs of how they've changed over time and kind of what things will look like. It shows you, I think, 6 hours of prediction of, the insulin absorption and when the insulin will kind of wear off, where your glucose is headed. So I really like that predictive feature, and it's something that other systems don't have.
Yeah. It's really it's unique because it's using that open source or DIY Loop app as its algorithm and as its user interface. It's a slightly older version. It's not the most current version of the Loop app that's become pretty popular in the type 1 diabetes community. So, the components, and we should probably kind of lay this out. You've got the pump itself, which is the Oreo cookie, and it's a tubed pump. And the infusion set that's used with this exclusively is called the Cleo. And this was an infusion set that was developed more than 15 years ago by a company called DiabeTech. They had a pump called the Cosmo back in the day. It's a very simple infusion set. It's, one push, it's self-inserting. It's a 90-degree soft cannula infusion set. The sensor or I should say sensors that work with this now. One is the Libre 3 Plus sensor from Abbott, but it recently got approval to connect with the Eversense 1-year sensor. That's the implantable sensor. I don't know anyone who's using it yet with that sensor, but it has that capability. And
Yeah,
then
I
I
believe there
mentioned,
are 20 people at least using it right now, the integration, but it's not wide scale at all.
it's
It's
not
more so
publicly
going through
available,
testing.
but
Yeah.
yeah. And as you mentioned, the algorithm is the Loop algorithm. They call it the Twiist loop algorithm because they've adapted it a little bit from the original loop concept in order to be able to get it approved by the FDA. They had to put some guardrails up so people couldn't set really extreme settings like the open source version of loop lets people do. And yeah, I'm like you. I think the loop algorithm is what makes this thing really unique. The 6-hour prediction is only possible because the user must enter not only their carbs, but also tell the system if what they're eating is a slow, medium, or fast digesting type of a food. So the algorithm is balancing active insulin against active carbs to make a long-term prediction. And no other system is looking beyond really 1 hour in predicting where the glucose is going to be. This one can predict 6 hours out with fairly good accuracy of what's going to happen. And I think that's kind of the secret sauce that makes the algorithm so effective on this particular system. Is there anything else you found truly unique about this whole Twiist setup?
Yeah, I mean, the target range is significantly lower than the other systems. You set a range, so you set a top and a bottom, and that bottom could be as low as 87 milligrams per deciliter, which is much lower than the 100 milligrams per deciliter, I think, which is the lowest. Is that Medtronic is 100?
Yeah, and
So,
Tandem is locked in at 110, and Insulet for the time being is also 110. That's going to be updating shortly.
yeah.
Which it's safe for a lot of people, but those who want really tight control, it leaves something to be desired.
Well, yeah, and so I'm waking up with this system with a flat line of 90,
Mm.
and it's just such a beautiful thing to wake up to, and I'm not having lows. I mean, like, I'm not having any more lows than I would have if anything, I think I'm having less lows than I have on any other system. I do think that because I've been using a similar algorithm that I had a little bit of a jump start at getting the settings refined on this, it happened pretty quickly, but I'm in a really good place with this. And I mean, let's see, did I wake up? Yep, that's how I woke up this morning. I woke up hovering around 80,
Yeah,
83 this morning. So yeah,
yeah.
I went a little below range, but like I'm happy with that. Like,
I mean, that's unique. I mean, any system, any AID system that's working right, that's beautiful. You're going to wake up pretty close to target, and from middle of the night on, it'll keep your glucose in range, nice and level. The unique thing here is that you can just be at a lower level. You don't have to be in the low hundreds. It can be in the 80s, 90s, 100 range if you choose to. I got to be honest, I still have my target set at 110 just because I run into more issues with hypoglycemia due to all the workouts I do. And I'm comfortable with those fasting readings in the 100, 110, 120 range. But for a lot of people, that's just not good enough. Be able to set a tighter target is nice.
yeah, and another area I found really helpful is when I'm working out. So I think that this is the system compared to like Omnipod 5 and Mobi, this is the system that I was like the fastest to understand how to set my settings in a way that don't make me go low during a workout. So on Twiist, there is a button that allows you to put on a workout preset. You can put it on for 1 or 2 hours or until you turn off. I wish there was the ability to set it for like a certain amount of time over 2 hours because obviously that would be allowed. But anyway, those are your only options right now. So what I do is I actually go into my settings and I can change what that workout preset range is whenever I want. It's just a little annoying. You have to go into the settings and change it. So I change it like if I'm going to go out dancing, I know how that workout will be. Maybe I'll set my workout range to 140 to 160. If I'm going to go on a run, my typical workout range, what I put on is 200. And I'm sorry for all the people that don't use milligrams per deciliter. If I put out a workout range, I put a higher range of 200 to 240, and I put that on an hour before I work out, and then I run, and it works. It works every time.
Yeah.
So working out with this, the ability for me to change what that range is so easily. There's other systems you put on like an activity setting that's like pre-programmed. You don't even really know what it is. I like the control here
Mhm.
for workouts, especially, or just like daily activities.
Have you ever started eating a meal and then realized after the fact that you forgot to bolus? I'm not saying
I
just with Twiist, but with any system.
yeah,
'Cause
I'm sure it's
we've all
happened
done
before.
that.
Yeah.
And, the challenge with these new AID systems is that if you bolus late, not only does your glucose spike super high, but then it's likely to go low a few hours later because it's already added to your insulin delivery to fix the high, to the rise, and then you cover the food on top of it. I really like that the algorithm within Twiist, it allows you to both back enter and front enter when your carbs were eaten. So if you know you're bolusing late, you can say, all right, I had these carbs half an hour ago. It won't overdose you that way. And if you know you're going to be eating soon, but you don't want to be thinking about your diabetes, you can front enter your carbs up to an hour ahead of time. So that's unique with the Twiist version of Loop, the ability to be able to do that.
And I'm constantly doing that. It happens often where you're cooking a meal and or you go out to dinner and like you wind up getting the meal and you're like, "Ugh, I actually don't want to eat as much as this, or I wound up not eating as much." You can
Yeah.
also go back and adjust the carb entry. If you ate 10 grams less, you can go back and let it know. Obviously, you got the insulin already, but now the algorithm knows, okay, he actually didn't eat those 10 grams. We're going to adjust for that. And then, yeah, like I go back. Sometimes I enter carbs and then I forget to eat. So then I rush to cook the meal or get the meal. And then I go back to the log entry and then I change the time to like
Mhm.
20 minutes later in time. So I'm constantly adjusting that and letting the
Yeah.
algorithm know. And that is a really nice
Yeah,
feature.
the algorithm adapts on the fly to those changes. What it does is it changes the predicted glucose over the next several hours. And that's an important thing. And it shows you right on screen what that predicted glucose is. And if your actual blood sugar deviates from that predicted glucose, that's when it starts making adjustments to the delivery. Now, this system will only adjust the basal delivery. It won't administer automated correction boluses. It just makes increases to the basal in an effort to fix a projected high glucose value. And it's one of the areas where it's not quite caught up with the latest technology. The current version of Loop, as well as some other AID systems, like Tandem, for example, will administer correction boluses rather than just bumping up the basal for a while. And the advantage there is time. I mean, a bolus will fix things faster than a basal adjustment will. So it just gets you back to into your target zone that much faster. Do you use the Apple Watch with your Twiist system?
I do. It's funny. I stopped using it with Loop. I stopped wearing my Apple Watch, but through testing, I started wearing it again with this system. And I really liked having the controls on my wrist. I forgot how much I liked it for quickly checking my levels, seeing the graph trend, logging the meals, or even putting on the pre-meal target, which is a quick little thing you can do before you eat. It starts lowering your target. It lowers your target even lower to
Mhm.
80 milligrams per deciliter, being like the
Yeah, and you can
lowest.
customize that too. You can set it
Yeah.
as low as 67.
Oh, I thought the lowest was 80, which is what I have it set to because I probably would have it lower. Let's see. Yeah, the lowest you can do is 80 milligrams per deciliter, which I have it set to 80 to 87 on mine for the pre-meal target.
Yeah, double check in your settings. You should be able to set that as low as 67. It should be customizable. I can't see it on the screen. Mine went as low as 67. The insurance coverage is also kind of unique with this because Twiist or Sequel Med, which owns the company, is typically billing through prescription benefits for this. So people who have large copays and deductibles on their health plan, it can save them quite a bit in terms of the out-of-pocket cost. It doesn't usually require pre-authorization if you go through prescription coverage, so that's a nice thing too. I know some other companies are doing similar things. Insulet, they attempt to get the Omnipods through prescription plans whenever possible, and even Tandem and MiniMed are doing similar things now. But that's that
And Medtronic just made that announcement that they're
yeah.
working toward pharmacy.
Think Like a Pancreas, the podcast, is brought to you by Integrated Diabetes Services, where experience meets expertise, passion meets compassion, and diabetes care is personal because we live it too. Our team of clinicians, all living with type 1 diabetes, understands the challenges firsthand. We're here to help no matter where you are in the world. From glucose management to self-care strategies, the latest tech, sports and exercise, weight loss, type 1 pregnancy, and emotional well-being, we've got you covered. We offer consultations in English and Spanish via phone, video chat, email, and text. Want to learn more? Visit integrateddiabetes.com or email info@integrateddiabetes.com to schedule a consultation.
Okay. One of the things I was concerned about when I first started, trying the Twiist was that I wouldn't be able to use my Dexcom sensor with it. And I've been a Dexcom user and advocate for a long, long time. Every company has its issues, but for the most part, I've been very happy with what Tandem's brought to me in terms of my quality of life. I was concerned about having to switch to an Abbott Libre sensor. Historically, anytime I've tried a Libre sensor, I was getting a lot of false low alerts. How do you feel the Dexcom and Libre 3 Plus compare?
So I haven't noticed much of a difference, which I think is really good. I'm just living my life with glucose readings being sent to my pump and never finding an issue with the
Yeah.
number.
Yeah.
Could there be
I've been
variation? Maybe.
very
I
happy
don't
with the
realize it.
transmission. The transmission quality, I found has been better than what I ever had with Dexcom.
Yeah, the connection's good, and my insulin dosing seems to be on point, and I don't notice lows or highs that I'm
Mhm.
having where my system's not telling me that. The one thing, and I love the 15 days with the Libre 3 Plus. Of course, Dexcom is bringing it. It just came out with their 15 days, so that's great. It is smaller and way less noticeable, the sensor. It's funny. I mean, it is significantly smaller than the Dexcom, and I notice that by how much I don't notice my sensor. One thing that is missing that I hope can be resolved in some way is the Libre sensors can only connect to one device at a time. So the sensor connects to Twiist and can't connect to the Libre app, whereas the Dexcom G7 can do both when it's connected to pumps. That opens up the door for seeing the insights on the Dexcom app and also putting on all of these fantastic snooze alerts, quiet mode alerts, like all of these great settings. With Twiist, I have no ability to see my glucose levels over the past few days, understand my trends, and there's some really great insights on the Libre app that are sorely missed.
Mhm.
There's amazing insights on the Libre app, and you don't get any of those with this. You also don't have the more advanced settings for alarms. You do have some alarm settings, but in my opinion, it's not enough settings. Like the fact that there's no
Rise rate, fall rate.
yep,
There's no
there's no
option.
rise rate, fall rate. No.
There's no delay first alert with the high. That's not in there. I like those features. I use those
Yeah.
a lot with the
No
Dex.
quiet mode, which is a big one for me, like going to the movies. You can turn off alerts, but I don't want to turn off alerts. I just want them to not make a sound.
Yeah,
You
and
can have them the
I'm so
override. You
used
can have yeah.
I'm so used to seeing that 3-hour trend graph because you can see what was happening recently, what's happening currently, and you don't get that option with the Libre 3 Plus. At least when you're using it with Twiist, you can see the last 10 hours and you can see the last hour. There's nothing else available to you other than those two, unless you found a way to see a different time interval than those. Did you find that?
I don't know. Well, so I know when you tap the number in the top left, it does show you the last 20
Well, a
when you
24-hour
tap.
graph
But
looks
that's all you get.
yeah, it's
And you
not
can't even
very
put your
used.
finger on it. You can't put your finger on it and swipe through it to see what the readings were, which is something like I automatically tried to do. So
Mhm.
it's just it's very limited with the abilities or features with
Yeah.
CGM.
So the sensor's functional, definitely functional. It
Yeah.
just it doesn't have the extra buzzers and whistles that Dexcom has that can sometimes make life a little easier to and diabetes a little easier to deal with. I agree with that.
Yeah, and
Do you
I think
find that
yeah,
the inability to calibrate is an issue?
haven't missed it at all.
So
I forgot.
if the sensor's reading low and you feel fine and you finger stick and you're 110, Doesn't bother you that you can't calibrate and tell it, hey, this signal is not correct. We need to adjust.
Well, what I'm saying is I've never noticed that. I've never had a low, but my app didn't tell me I wasn't having a low,
Mm.
or vice versa. I've just been living life. Like, I truly, the last 3 months of wearing it, I haven't noticed an issue with that. I'm sure there's been variability, but it's never been noticeable.
The infusion set, it's cute. It's purple. The inserter is simple. It's very small and compact. Did you find any issues with the one infusion set that you can use with this?
Yes.
Let's hear.
I think that that's the major downfall, like one of the main cons to this device. So it's the Cleo set. Like you said, it's 15-year-old technology. I can't even believe they still make them. That doesn't even make sense to me that they're still able to procure them and that there's still a factory that will make them. It's not great, the Cleo set. There's a big learning curve to it. And once you get the learning curve, you start to not care about it as much. But I'm currently at like an 80% success rate where 20% of the time of when I put them on, I mess it up and it doesn't go on. Meaning that if I'm going on a day trip or if I'm going on a weekend trip, I bring double the Cleo sets that I need just in case they fail me. So when I look at it, I like the look of it because it uses like a clear adhesive around it, which just makes it a cleaner style. I like that it has this like protruding cap on it that you can switch the angle of the tubing. I really like that. That's something you don't get on other tubes. But putting it on, I have to use like a skin tack or a skin prep wipe. Otherwise, it won't stick on. There's also when you unscrew it and you like before you put it on, you have to like use your finger around it to loosen up the adhesive. There's all these tricks that Sequel MedTech told me about in order to use it.
Yeah,
But it's just unfortunate.
took me 3 or 4 tries to get it right because every time I would insert it and I would try to remove the inserter, I would pull the cannula out of my skin.
Yep.
And that just shouldn't happen. You end up wasting sets that way. And they only have one cannula option. It's a 6 millimeter plastic cannula, and it's not quite as flexible. It's not, wiggly like a piece of spaghetti. It does tend to pinch and crimp under the skin pretty easily, and only one tubing length of 24 inches. And say what you will, a lot of people prefer the longer tubing, but it's just not an option to get anything longer than 24 inches. I think it's important to offer people options. Ironically, this pump uses what's called a luer lock connector, where the infusion set tube connects to the pump. 20 years ago, every pump used a luer lock connection. And then gradually the pump companies came to realize, they could buy another company's infusion sets and use them on our pump. So they started making proprietary connectors. Now, Medtronic was the first with their paradigm connectors, but every company since then, they've customized the connector so you can only get your infusion sets from that company. So the luer lock hasn't been used in a long time. Now we're back to the luer. We come full circle. Now, Twiist is using a luer lock set, but you can't get any other kind because they just stopped making all the other versions of it. There's no angled version. There's no steel needle version. You can't vary the length of the cannula or the needle, can't vary the tubing length. And like you said, you got to use adhesive aids to keep it in place pretty securely. So that's something I'm hoping Sequel will take to heart because the infusion set is where the rubber meets the road. If your infusion set's not functioning well for you, it doesn't matter how good the pump or the algorithm is, it's all going to get blown up. It's just not going to work right.
Yeah, I will say it does stay on, which is good. I have yanked it off a couple times, more so early on when I first started wearing it and I wasn't used to wearing a tube pump and it frustrated me. I have had a couple kinked cannulas. I think that 90-degree angle is tough because it's going directly against your muscle and that could put pressure on it. I do notice that when I lean on it, it does cause an occlusion. I get the advanced occlusion alert. I get a lot of them.
Yeah.
I probably get 2 to 3 a week telling me that there's an occlusion. I'm glad I get the alert pretty quickly, but it wakes me up in the middle of the night because of how I'm sleeping. I have to
It's a
readjust.
double-edged sword. It really is. Sequel was very proud of that feature. It's a very, very sensitive occlusion detection system, which is great because if there is an occlusion, it's important that you know so you can change out your infusion set. But sometimes it's too sensitive and you end up getting repeated alarms and you may not have needed in the first place. So yeah, it's 6 of one, half a dozen of the other as far as the occlusion sensor, whether people like that or not. The only button, or if you want to call it that, on the pump, it's like a little blue notch, and you press on that and it delivers in fixed increments, which is unique because the Omnipod doesn't have that feature. But you can do that with other pumps, is this one button bolus feature, but it's locked in at 1 unit increments. And that's something I certainly hope the company is going to change in future iterations because some people need different increments for their boluses. Do you use that feature at all? The quick bolus feature?
So I've used it once and like officially used it once. I've tested
Mm.
it a few times. I wish that it gave it in increments of grams because my brain thinks in grams and it doesn't think in units. Of course, I could give myself insulin with it and then go log the carbs later
Mhm.
and it will, figure it out. So you can deliver up to like 10 units of insulin with it or
Mhm.
up to your max
Right,
bolus,
your max
which
bolus.
is crazy to me, but I do like that. So you could just click it 10
Mhm.
times and then confirm and it will give you that insulin.
Yeah, I think Tandem's the only one that has the feature where you can enter carbs per
Yeah.
press, and it'll just do the math for you and deliver the appropriate dose.
Yeah. So I I like that there is a button. I don't use it much because my brain doesn't work like that. But it's possible that if I was out during the day and my phone was kind of far away, I could use it if I was grabbing food. One feature of that button that no one told me about, and I figured it out by myself by accident, was if you suspend insulin on the pump to shower and then you connect the pump again, you don't even need to use the app. You could just hold down on the button and it will make that sound and it
Hmm,
will start insulin delivery again.
I didn't
You
even
can't
know
do it
that.
the opposite way. No, no one told me. I'm like, that is the coolest because that's one major gripe I had with Tandem Mobi. I mentioned it in the review was that like I wish I could suspend and restart insulin just with the button because I don't every time I'm showering, I don't want to have to run for my phone. You can only restart the insulin delivery, but I'll take that.
And speaking of the beeps, this is another potential double-edged sword. Do you find the alarms that the pump emits to be helpful because you notice them, or annoying because they're ungodly loud?
For the occlusion alerts, appreciated them. They wake me up at night and get me to do it. And they haven't annoyed me. Well, it's annoying that it's happening, but it's been helpful. But I'm also not sleeping in the same room as someone, so it could be annoying. I will say that the alerts during the day, especially when I'm around people, are highly interruptive. The first day I had this pump, I didn't know what the alert sounded like. So they were going off and I kept walking around my house because I thought that like the fire alarm was needed a battery switched out. That is
Mhm.
exactly what the sound is. It goes beep and I'm just looking around. There's a fire thing in my room in this office. I'm like, does it need a battery or
You're
something?
putting on your jacket, heading out the door.
It was so funny. I almost emailed the building to say, "Hey, there's something going on with one of my fire alarms." But then I realized it was the alarm. The alarm is really loud and annoying and cringy. And especially like the other night I was watching the Golden Globes with friends. I was having a low and the beep was going off and it like stops everyone in the room. And that's not what you want as someone with diabetes.
Yeah, perfect world, we'd be able to customize how loud it is for different features. If there's an occlusion, like you said, I need to know. Make that as loud as you want. But things that I can tend to, in a short while, I don't need those to be alerting everybody in the vicinity. Those can be toned down a bit. One other function or characteristic of this that bothered me a bit was just the sheer number of parts and pieces involved. I mean, granted, it's a very small, compact pump, but with so many parts and pieces, because you have batteries that have to be recharged, and they're weird little batteries. You can't just pick these up at CVS. These are special batteries and special chargers. You have filling syringes for filling up the cartridges. Just a lot of parts. I counted 8 different parts that are required for doing a change out and 32 steps for doing a change out of the cartridge and infusion set. That's a lot. It's a lot of work to have to do every 2, 3 days. Did that bother you, or did that get in the way of your enjoying the system?
There are a lot of parts, and I'm not used to that, especially as someone who's used Omnipod, where everything you need is right in the little package,
Uh-huh.
besides the insulin and an alcohol swab. So I found myself in situations a few times where I didn't have the piece I needed in order to do the infusion set. I went to CVS and, like, when I was in New York, I didn't have the needle. Like, I forgot the needle, and not only do you get a needle, like a syringe, there are 2 parts to the syringe. There's the syringe, and then there's the needle connector. If you forget one of those pieces, automatically you can't do an infusion
Right.
set. Then there's the cartridge, then there's the tube, then there's the Cleo set, then there's the insulin, the alcohol swab, the skin prep swab that you need in order to put
Mhm.
on the Cleo set. So there are and then the battery, and then the charger for the battery, and then the wire that charges the battery charger. There are so many parts. And yes, there was also a moment where I was running on 12% and I had to watch my niece and my sister, and I was like, "Oh my goodness, like I don't know if I'm going to make this." I had to be in like Brooklyn, and I was looking every hour, I was looking at the battery percentage of my pump, and it was counting down slowly. I will say that the battery charges does lasts a long time, at least when you first, batteries wear down over time. But, like, right now, I'm probably getting about 7 days of battery life,
Mhm.
and you're supposed to switch out the battery with each set change, which I don't do as often as I'd like to. I've gotten better about it because of that 12% debacle. But, like, having to think about how much battery's in my pancreas is not a fun experience.
Right.
Yeah, all the parts are difficult. I think that that could be solved with packaging. Twiist did a really good job with their packaging, but I also think that they could have done a better job. And
Mhm.
maybe once they're more streamlined and have the money to change up packaging, I would love to see a package that holds a lot of these pieces together, similar to Omnipod.
Yeah, you just have one pouch that contains everything instead of everything in separate boxes and having to collect it all yourself.
So much room for a mess up.
Yeah. On my website, we have a blog called Thinking Like a Pancreas blog, and we did post a very detailed set of comparisons of Twist to other AID, automated insulin delivery systems, as well as comparisons to the existing version of Loop that a lot of people use. Typically, that's used with an Omnipod. So I encourage people to check that out. It'll be in our show notes, as will the link to the DiabeTech podcast. So let me ask you one other thing just related to this pump. Who do you think is an optimal candidate for this? I mean, if you could kind of illustrate, draw a picture of the type of person who could really benefit from this system better than they would from other systems, who would that be?
I think that you have to like tube pumps or be okay with them. That's number one. I think that this pump is for someone who wants all of the information and details and more control, but wants to be on an FDA cleared system. Because, of course, you can get a similar algorithm to this with even more capabilities with Loop. But if you prefer tubed, then this is a good system for you. And if you want even stronger time and range, then this is a good system for you. I just think that, like, you just have to be okay with the physical aspect of a tube and kind of
Do you
weigh
feel the
that with the
tubing?
control.
Do you feel the tubing is a serious detriment?
Yes and no. Throughout the day, for the most period of the day, I don't notice and I don't care. But it's those little things, it's those little moments that you just wish you didn't have to be reminded you have diabetes. Sitting on the toilet, taking a shower, getting dressed, going to the gym, going to play a sport with your friends, ripping it off, which of course can happen to a tubeless pump too, just not the same way and not as often and not as like, well, it's always gonna be unexpected. It is, I mean, for me, it's almost enough. No, it's enough of a burden knowing that I can get on Omnipod and use DIY Loop.
Mm.
So I can use a tubeless form factor and get the same algorithm. That's the world we live in. Of course, it's not FDA cleared, but I have that option.
I agree with everything you said because I felt the same way when I was using Twist. about the tubing. I'd used tube pumps years ago, and I did fine with them, no big deal. But when I went on Omnipod for quite a while and then back on a tube pump with the Twiist, I started noticing again those little things like you just described. And they are kind of annoying. I know that the loop algorithm is a very, very good one, and it allows people to customize their settings really nicely. And I don't want to minimize also in the loop algorithm, you can customize your basal settings, unlike things like the Omnipod and the Medtronic, where whatever basal rates you have programmed aren't used. It creates a flat profile for you. And being able to customize your basal settings, your background settings, I do find valuable for a lot of people. So having the ability to customize the way the system works is really valuable. But to build an open source system, it takes some technical expertise and some confidence and ability to maintain it yourself. And not everybody is comfortable doing that. I think for anybody who wants that customization and that high level algorithm, but isn't comfortable with building it and maintaining it themselves, those are the folks I feel would do great on Twiist. And you put up with the tubing, like you said, a few moments here and there through the course of the day. You can put up with the tubing just to be able to have better diabetes management. Otherwise, at least that's my thinking about who's a really good candidate for this.
Yeah, I mean, I will say ultimately I am really happy with the results I'm getting. I think Twiist is a real contender, and I'm so hopeful that people start trying it because I think they'll be really happy with it. And if the tubing isn't a big trade-off for them, they'll want to stay on it. I mean, I'm going through all the supplies I've had of this. Like I'm going to go through the very end. I'm not getting off of it early because it is working well for me. So it'll be interesting to see what things are like when I switch away from it back to my old form factor and system and kind of seeing how that feels after using this system. But I'm really hopeful for this pump. I think that we have another really great option for people out there.
Yeah, I just love the fact that we're able to get a open source type of application that was created by the We Are Not Waiting movement. Finally getting something like that through the FDA. To me, the FDA serves a valuable purpose. However, in terms of diabetes tech, they are one of the biggest obstacles to progress. I give Tidepool and Sequel a lot of credit for seeing this through and bringing a version of Loop to market in an FDA-approved form. So, Justin, I always like hanging with you. I learn things. Hopefully, you pick up some stuff along the way too. And I know DiabeTech is a wonderful podcast as well. I encourage everybody to check it out. Look at the archives. Check out some of the new things coming out. I'm really proud to produce the series with you at DiabeTech on kind of optimizing technology. As we both know, just having the tech doesn't cut it. You got to know what you're doing. You got to know how to use it right. So hopefully,
Yeah, our new segment has been really helpful for me, but also the feedback we're getting from everyone that it's just such great information, and we're knocking out all these different areas like optimizing your basal insulin, your CGM alerts, your CGM data, bolus insulin, all that stuff. So yeah, well, I definitely recommend people listening to this to go listen to us over there. And there's just so much to learn. So and you can find everything I do is on diabetech.info, the website.
is there a good picture of you there?
There's definitely a picture of me somewhere on there.
We got my photos on my site so everyone can vote and say who's really the handsomer.
We'll put a poll in our next newsletter.
I am going to lose badly at that. Anyway, thanks again for joining me today. And to everybody listening, I'm Gary Scheiner, reminding you all to keep thinking like a pancreas.
Thanks for tuning in to Think Like a Pancreas, the podcast. If you enjoyed today's episode, don't forget to like, follow, or subscribe on your favorite podcast app. On behalf of Think Like a Pancreas, the podcast, I'm Gary Scheiner, wishing you a fantastic week ahead. And don't forget to think like a pancreas.